It's my great pleasure to introduce Dr. Jan Scarlett. Dr. Scarlett is a professor of epidemiology at Cornell University. She is the director of Maddie's shelter medicine program there. Dr. Scarlett was the first person who had a shelter medicine course. She's a real pioneer. She started that 10 years ago. Her current interest of research and teaching focuses on the prevention and control of diseases in animal shelter. So, Dr. Jan Scarlett.
So I've been asked to talk about this myth that life-saving strategies lead to warehousing of animals, which leads to unhealthy animals. And I thought we would just start and look at what Daniel Webster would say about what is a warehouse. Well, I think this is a nice modern warehouse. It's a storehouse for goods or merchandise. And Daniel would go on to say that it's a place where we set aside or accumulate things as for future use, or to confine or house in conditions suggestive of a warehouse. And I think that all of us could agree that looking at a warehouse, this is not a facility that is conducive for keeping dogs and cats. And that none of us really want to think about warehousing animals. There is a definition here about confining mentally ill people to large institutions for long-term care. That's why so many of those institutions no longer exist, because they weren't humane places. And so we want to strive not to warehouse animals. So where does the myth come from then? Well, it has everything to do with intake and outflow from a shelter. If you've got more animals coming into the shelter than you have cage space or staff to take care of them, then going out of the shelter, then they're going to begin to accumulate. And when they accumulate, if your adoption rates don't keep up or your transfer rates don't keep up, you're going to begin to essentially warehouse animals, to stock them up, waiting for the right person to come in, which is going to lengthen stays. We heard this morning from Robin and Suzanne that there are a lot of strategies to assist you from preventing that warehousing from taking place. Things like restricting intake. If you can't get animals out fast enough, then stop taking animals in. You need a good foster care network. That will help. You essentially create a virtual shelter. And your foster care people can be, as was mentioned, some of your best adopters as well. You need an effective adoption program. You're going to be striving to increase your adoptions. Many shelters are using transfer programs, especially overcrowded shelters in the southeast where we have an abundance of dogs, and northeast shelters that often are looking for dogs, so that we can actually get animals out of shelters in the southeast by transferring them. And then, of course, enhanced return to owner rates. We need to do a much better job, especially for cats, of getting our cats back to their owners. So all of these are strategies that can minimize the emphasis or the reliance upon euthanasia to help balance out that intake with outflow. What I'd like to do today is, because I'm a veterinarian, I'm going to look at it through veterinary eyes, and I'm going to look at it through health issues of animals in the shelter. If you fail to follow these strategies, and you continue to take animals in with the belief that by taking them off the streets you're going to save more and more, and that by just crowding your shelter you're going to save more animals, you're going to lead to longer stays in the shelter. And we have good evidence to suggest that longer stays leads to more disease. So you get more sick animals, you keep them for longer, therefore you increase the risk of having deteriorating behavioral issues in those animals, and you end up with generally low overall welfare of those animals. So let's talk a little bit about this increasing length of stay. The longer you have an animal in a shelter, and we know that you're not ever going to keep infectious disease agents out of a shelter. They can walk in with an animal incubating disease. The animal looks perfectly healthy when it walks through the door, but in fact, it has its incubating agent. And not all infected animals, in fact, show clinical signs. So you can have animals that look perfectly healthy, and they are shedding agent into the environment. So you're never, I mean, for those of you who have children in daycare, is there any daycare in this country or anywhere in the world, frankly, that doesn't have disease? You put mammals in an enclosed space and keep them for a while, and you're going to have disease. You're going to have circulation of infectious disease agents. Our goal, of course, is to minimize the amount of disease load in the shelters, but also minimize the disease in those animals. And so the longer you keep an animal in a shelter, the more likely that animal is to encounter an infectious disease agent. So we want to get, from a health standpoint, animals in and out as quickly as we can. The other thing that length of stay does is it ties up cage space. So that if you have, and let's just take an extreme example of one cage, and on average it takes you 3 weeks to get that animal from the time it enters to the time it leaves, 3 weeks to get it adopted. If you can shorten that average length of stay to only 1 week, then over a 3-week period, you can manage and handle 3 animals as opposed to only 1 animal. You can actually move more animals through, save more lives by just shortening the length of stay. So you decrease the likelihood the animals get sick, and you increase the number of animals that you can manage. And then, of course, the length of stay, especially for pit bull crosses, and a lot of dogs, and cats too, for that matter. The longer they stay in the shelter, the more likely it is that they're going to develop some kind of behavioral issue. Stereotypic behaviors, which makes them less adoptable. The less adoptable they are, the longer they stay, the less animals you're able to move through. And to say nothing of the suffering that results from either behavioral problems or disease. Animals are suffering. We don't want to be in the business of causing animals to suffer. So this is a don't be intimidated by graphs. I deal a lot with data, but what I want to point out here is this is some data that we had from a study that we did in Springfield, Massachusetts some years ago. And this is the probability that a cat coming into a shelter will develop an upper respiratory tract infection by the number of days that it's in that shelter. So if you look, if we started with 100 animals coming in, 100 cats coming into the shelter, after 5 days, about 11% of them will have developed upper respiratory disease. By 10 days, over 50% of them will develop upper respiratory disease. You get out around a cat staying for 15 days in this shelter, and well over 80% of those animals will have developed upper respiratory tract disease. And that's a function of the longer they stay, the more likely they are going to be exposed, as well as in cats, we have a herpes virus, which causes a lot of infectious disease, causes a lot of the respiratory disease. What happens? What's a major trigger? Stress. What's more stressful to a cat than going into an animal shelter? So we need to get these animals in and out as quickly as we can. I'm not suggesting you cut corners, but do it well and get them in and out, and we're going to keep those animals from suffering, and we're going to open up cage space. So this is just kind of to reiterate what we were talking about. When your intake exceeds outflow, animals accumulate, your staff has a harder and harder time caring for those animals. If you have more animals coming in than you have cage space, what do you do? What have all shelters all done? They've started to accumulate animals in crates, more crates piled up. There are more spaces to be cleaned. When you have more areas to clean, then you have staff now, because your staff is probably not kept up with the number of animals coming in. they begin to take cutting corners in order to clean. So they diminish the effectiveness with which they're cleaning, which increases the amount of disease in the environment. And you begin to see disease rates rise. You've got more animals than you can get adopters to take out if you're not paying attention to your adoption program. So the time in shelter increases, which also increases disease rates. What happens to your isolation? Now you've got more sick animals. You've got only a finite number of isolation cages. Suddenly your isolation breaks down, because what are you going to do with those animals? You're either going to euthanize them, but if you're making the transition from not relying upon euthanasia, then you're going to put those animals outside of the isolation area. There's nothing more infectious than an animal that's displaying signs. It's coughing, it's sneezing, or it has diarrhea. Those are ways that agents have evolved to spread themselves around. So you want to keep animals that are isolated truly isolated. And then the length of stay increases, because what do? We hang on to sick animals longer. We wait till they recover before we adopt them. And the cycle starts again. So these are certainly not all of the ways. These are just some suggestions to you about how you can prevent this accumulation of animals and this tendency toward having more sick animals in your shelters, and yet still achieve an adoption guarantee status. The first and foremost, and it may sound kind of odd that the veterinarian is talking to you about good management, but good management is key to a good health program and keeping animals healthy in that shelter. It's also key to preventing overcrowding. And we'll talk a little bit more about that in a minute. We're going to make health a high priority, because unhealthy animals increase stays, which leads to overcrowding. As part of making health a high priority, we're going to have goals for that health program. We're going to pay attention to how long that animal is staying in the shelter. Where are the bottlenecks? What's slowing down that animal from the time it enters the shelter until it leaves? And then we're going to talk a little bit about how do you monitor the health of the population of animals. We know how to monitor. We know well how to monitor whether an individual animal is sick. We look for signs. But how do we know how the whole population is doing? So we'll spend a little time talking about each of these. So management. You heard a lot about management this morning from Robin and Suzanne. It is key to achieving an adoption guarantee status. It's also key to really efficiently running a traditional shelter. So you have to have good leadership. And you have to, if you think about the health of animals in your shelter, whose responsibility is it to keep animals healthy in the shelter? If you think about it, it's every single person who will handle that animal or has anything to do with that animal. It's not just the veterinarian. It's not just the veterinary technician. It's every single person in that shelter that handles those animals. Why? Because if a person handles an animal roughly, it increases that animal's stress. Stress goes up, susceptibility to disease goes up. If a person doesn't wash their hands between handling animals, going from a sick animal to a healthy animal, they can be, and probably are, the single most important mode of transmission of our infectious disease agents. So if management can impress upon every staff member that's hired and in every training program that they have a role to play in the health of the animals in that shelter, then that's what we have to do. That's going to be an effective way of minimizing disease in our shelters. And management has to do that. Your veterinarian can't talk and be involved in talking to every staff member. Your veterinary technician can't be. It has to start with the shelter manager or the executive director, because everyone has to play a role. And then clear responsibilities. If you have a staff member who's assigned the task of delivering medications in the afternoon, then that person has to have the time. They can't be constantly being pulled off of. You have to have adequate staffing so that the people that you assign tasks, and I'm talking right now about health-related tasks, but it could be any particular task. If you're constantly pulling them away from it, then you're going to have animals that aren't getting their treatments. So having good management, and we talked about accountability this morning, and I absolutely agree with that. I think sometimes accountability carries with it some kind of negative punishment connotation. I don't think that's necessarily true. I think instead, what you say, you have staff members who've been trained to handle animals in a certain way, to wash their hands. If they're not doing that, remind them. Not in a punitive sense. Maybe you have to if eventually they don't pay attention to you, but first of all, the carrot's going to get you a lot further than the stick. And so teaching them and reinforcing that they have a role and that they actually can control whether this animal gets sick or not. Most people coming into shelters are there because they care about the animals. Go back to your mission of caring for animals. And I also, when I listen to my behaviorists talk about positive rewards and positive reward-based rather than punishment-based training in dogs, I often think about people. Because we, in fact, even if we're training our dogs positively, we often manage our people with punishment. I think rewards can do so much more to get people to do things. Now, every once in a while, of course, you're going to have to resort to some punitive measures if the reward doesn't work. But I think we need to concentrate on managing our people in a humane way, just like we handle our animals. So, have you gotten the notion from Suzanne and Robin and myself that management really is key to moving forward with your no-kill goals? So, I walk into shelters and I look around, and in some shelters I really wonder whether the health of the animals in that facility are a high priority to that shelter. And why do I say that? I served for a while on the board of directors of the Tompkins County Shelter, and our board had a variety of committees that most boards do. And one, for example, was the Budget and Finance Committee. And so there was a committee devoted, because raising money is so important in a shelter, there was a committee who had its central goal to oversee what was happening with the health, or excuse me, with the finances of that shelter. And they would set goals, and they would measure whether they were reaching those goals, whether they were over budget or under budget. When you go into a shelter and there is no committee or even a designated person who's really responsible for the health, then who is? Who is responsible? If everybody's responsible, and I do believe everybody should be, but nobody's really taking leadership on it, then it breaks down. What happens is that essentially no one is overseeing that all of the health-related protocols are being adhered to. So one of the things that hospitals have done, human hospitals have done, is that they've hired an infection control nurse. Sometimes they're called the nurse epidemiologist in these facilities. And that person is actually, their job is to oversee the implementation of health-related protocols. And I haven't yet entered a shelter, I've been encouraging some to do that, to actually designate a person who is there, sort of the eyes of the veterinary staff, eyes of the veterinary technician, to go around and see that whether or not people are actually adhering to hand washing between animals, actually changing their smock when they leave the isolation area. And again, this person has to be carefully chosen, because if they're going to be lording it over and making people feel bad, then that's not going to work. They're going to have to have good people skills. But their role is to go around and encourage, as kind of a cheerleader for adhering to health protocols and keeping animals healthy. So some other ideas about keeping health as a high priority. Again, I talked a little bit about the importance of staff training and retraining and reminding people that they have a crucial role to play in the health of animals in the shelter. I also, and I'm going to spend a moment on the next slide talking about the goal-driven, but then also feedback. If things are going really well in the shelter with regards to the health of the animals, reward people, tell people about it, let them celebrate with you that we've actually kept more animals healthy this month than last month. And that goes to my next issue of goal-driven. How many of you know what proportion of cats coming into your shelter develop upper respiratory tract disease, let's say in a month? Most people don't. You should. Is it 30% of the cats coming in? Is it 20% of the cats coming in? How do you know if you've made improvements? How do you know if you're making progress towards minimizing disease in your shelter if you don't know how many are there right now? If you implement new preventive measures, how will you know they're effective if you don't know how many animals are actually getting sick coming in? It'd be an interesting exercise. That's your homework assignment. That's the professor in it. And review them regularly. What progress have you made? And then report it back. Let's celebrate. Boy, last year we had 30% of our cats coming in developing upper respiratory. This year we've dropped that to 22%. Efficient flow-through. Animals come in and a lot of things happen to them. They get an intake exam. If you're a shelter that is able to do spay-neuter, you're going to neuter them. You're going to put them on the vaccination floor. Hopefully they don't get sick, but if they go into the isolation area, they're going to spend some time in the isolation area. Look for the bottlenecks. If it takes 3 days for an animal to get a medical exam, that's too long. You need to then strategize. Go to thinking about being resourceful. How do I shorten that period of time? If you wait 5 days to get a neuter, how can I shorten that? Do I need to get other veterinarians involved in the community? How can I make sure that I keep that animal in that shelter as short a time as possible? And, of course, you're going to hear a lot about innovative adoption programs and marketing, which have already been touched on, but we're going to hear more about this afternoon. But then I think there needs to be a daily assessment. I like to train our veterinary students that they should walk around and look at every animal at least for a few minutes every day, because they're going to pick up subtle signs of disease that, in fact, staff may miss. But also, what you want to do is go around with the idea of how long has each animal been here? This animal's been here 10 days. Why is that? What's holding up this animal? We need to move this animal through more quickly and spend some time problem solving and strategizing how you're going to move that animal through. And then I talked about, well, if you don't, you have to have a way of understanding how much disease is in the population. And the way that we do that is we look for signs, and the signs are essentially the incidence of disease, the frequency of disease. I think you're all pretty much aware that if you have an outbreak, you go, oh my God, we've got a lot more disease in the shelter right now. But more subtle changes happen that aren't necessarily an outbreak that you may be missing. And you're certainly missing the opportunity to watch the trend downward in the frequency of disease if you're not monitoring how much disease is there. And for those of you using PetPoint or Chameleon, those programs are facilitating the collection of disease data for you. And it doesn't have to be highly sophisticated. It could be, this cat was diagnosed with upper respiratory on January 2nd, and just enter that. And by the end of the month, you can count up then how many animals developed upper respiratory disease in that shelter for the month. If your denominator doesn't change, that is, your intake doesn't change much over the years, you may be able to just use the number of sick animals. If you've got real variations in the number of animals coming in, then you may have to adjust and actually calculate rates rather than just numbers. But start off simple. You don't have to do anything really sophisticated. It's just sick. This animal is sick. This animal has upper respiratory disease. This animal had diarrhea. And just tag it. And if you don't have a computerized system, frankly, you can do, and we did this at Tompkins County years ago when we didn't have a computerized system, is that we just kept a little log, a little book that you could tick off how many animals were sick. So and of course there are many, many other, and you're going to hear some of these strategies this afternoon from Dr. Levy, about trying to keep animals healthy while they're in your shelter. So in conclusion, I just want to kind of re-emphasize that you need to pay attention to management, that you have to alert and encourage your staff to think of themselves as being an integral part of keeping animals healthy, and that when animals get sick, it keeps them longer in the shelter, and if you keep them longer in the shelter because you're not efficiently moving them through, you're more likely to make them sick, and if they stay longer, you're more likely to see crowding. So monitoring what's happening in the shelter with your animals, the flow through, and even time to cure. You don't want an animal to linger in isolation for 14 days, 21 days. What's going on? Is the treatment adequate? Do we need to get this animal out into foster care because it's simply not doing well here in the shelter? So being vigilant as to what is happening in your shelter is key to really, in addition to all the things that we talked about this morning and you'll hear this afternoon, in achieving an adoption guarantee facility. So with that, I will take any questions that you have.